Cancers and depression, as well as chronic conditions like sleep apnea and migraines, are causing some of the biggest hits to our workforce. Researchers are counting the cost of poor health on our productivity at work. National Work reporter Bronwyn Herbert joins us now with more. Hi Bronwyn, so what has this research revealed?
Yeah, Roz, look, a team of health economists from Monash University have essentially counted the cost of different diseases and conditions on workforce productivity. They've looked at the impact of illness on people's ability to work, and also looked at time off employment, of paid employment, and captured that as well. Now, essentially, they've developed this metric really to look at that hit in terms of ability to work, but also to see where there could be benefits more broadly to the health system by investing in early intervention where possible, and also so that those impacts can indirectly then improve workforce productivity.
And Bronwyn, what did researchers find?
Yeah, look, the productivity index that they've created through their studies across a number of different diseases put breast cancer at the top of the list, then acute myeloid leukemia, closely followed by depression and other mental health illnesses. They also looked at chronic conditions that had made this list, including the effects taking a hit on productivity, including epilepsy, sleep apnea, and both chronic and episodic migraines, which affect 1 in 3 women. Now, we spoke with Katie Thorpe from Western Sydney, who's dealing with a metastatic breast cancer diagnosis, and she shared her workforce experiences.
Work is such an important part of my life still. It's obviously a necessity for things like paying my medical bills, being able to, make the most of my life as it still remains, but also have that sense of social connection and be able to continue to be an active part of a community, make sure that I'm checking in with people and talking about things that aren't related to cancer. It can become pretty lonely and very isolated when you are in the cancer world, and working and being a part of the workforce just allows me to still use my skills and feel like I'm still using that part of my brain.
That was Katie Thorpe. And just finally, researchers really did highlight the impact of where possible, where employers can provide flexible work conditions that really help boost workforce productivity for those living with chronic conditions.